I got a great email this morning from Sescali saying, Heather, what informative guests for Q&A will you have today? They've really made these mornings better for me. And my answer is we have Dr. Isaac Bogosh with us this morning as we continue to answer your questions about COVID-19 from the health perspective and the science and research perspective. There is a viewer demand for you, Dr. Bogosh. Welcome back to our program today.
Thanks for having me back.
So great to hear from you, and we're already getting all sorts of questions. So let me, can we just situate where we are? We're starting the Monday morning. March break is over. We're hearing about people not social distancing. What are the things that, as we start this Monday morning, that are really on your mind as a doctor?
You know, I'm really concerned about how we are handling this as a nation, and really there's no excuse. We all know what we need to do. It's been very clear for weeks what social or physical isolation or distancing, physical distancing truly means. And really the ball's in our court. We know what we need to do, and now it's time to actually do it, because what we do now and what we've done over the past week and what we do over the week ahead is completely going to determine our outcome here in Canada.
Okay, that's really important. You said social distancing or physical distancing. There are some people who are saying social distancing is just too nice and vague. People don't really get it. We need to say very clearly, keep your physical distance. Don't go out. You know, we need to be a little sharper and clearer in our messages. Would you agree with that?
Yeah, I completely agree. It's also more accurate. We have to physically separate from one another. And also important is, this is tough. Like, it's not easy to do. We have families, we have friends, we're social beings. We need to be as socially connected as possible, especially during these challenging times. And we have to be creative of how we do it with, online technology, with phone calls, with, shouting and waving at the neighbor across the street. But we really have to be as socially cohesive as possible, because we're all in this together, and yes, it's not going to be easy.
So stay apart, even as we are together using different mechanisms, but stay apart. So let's get into the viewer questions. Lee James writing, yes, we have to stay physically apart. He also wants to know about the hand washing, which is, of course, the other key piece of information we keep coming back to. But Lee wants to know, do you need to wash your face after you wash your hands, since it's through the nose or other places where the virus gets into our body?
No, I mean, we could take this to the nth degree, and I don't think that's very realistic to do and to scale on a mass level. I think, the key point is hand hygiene, and, we also hear about not touching our face. Of course, that's extremely challenging to do, very easy to see. Hand hygiene is really rule number 1, 2, and 3. And we try our best not to touch our face. Okay.
Gil Rinaldi would like to know about how to, be outside doing various activities. Many people are returning to jogging because the gyms are closed, etc. But Gil Rinaldi would like to know about cycling. Is that a safe activity we can do outside which still maintains this physical distance?
Yeah, I think that's a wonderful idea. I think it's easy to maintain a distance, at least a 2-meter distance from other people while doing that. It's outside, it's fresh air, it's great exercise. I think that's a terrific plan.
Jim Meek has a great question. You were talking about how we're all in this together, and within families it's challenging. It's certainly challenging for partners, man and wife or partners. Jim Meek writes, should his wife and he continue to sleep together, or should they be sleeping in separate rooms? He goes on to say, we have no symptoms. We're staying home except twice last week for an hour each time when she left the house for groceries and medicine, so they're following all the rules there. During the day, we're together, not always able to be 2 meters from each other. So do they sleep in the same bed, in the same bedroom?
I think if you ask 10 infectious disease specialists, you're going to get probably 3 or 4 different answers. Here's my humble opinion on the matter. We have to maintain some degree of normalcy throughout this entire approach while also balancing this with safety. Look, if both people are doing the best they can to be physically isolated from others around them, and both are adhering to impeccable hand hygiene after they've gone outside or maybe gone to the grocery store to get whatever they need, and there truly is not a larger social network of people that are coming into contact with them, then, stay in the same room. I think that would be completely reasonable. There might be people that disagree with me on that, but I think it's a reasonable suggestion.
Pat Van Harlem has a question for you, Dr. Bogosh. Pat is coming to the end of a 2-week period in self-isolation, and Pat would like to know, when it ends, can she go on with her normal routine?
You can go on with a near normal routine, but certainly normal routines don't exist right now in Canada and won't exist at least for the next 2 months and maybe even longer. So while you might be out of your social/physical home isolation protocol, you should hopefully be in a position where you're working from home, or your kids are home from school, or you're not, you're really still limiting your physical distance from others and keeping to yourself. So, it doesn't mean it's time to go out to restaurants and bars and be in public places. That's not what we're talking about here. It just means that your home isolation 14 days is over, but that doesn't mean business as usual, no.
So there's another question that flows from that, and it's from Ken. So if someone recovers from COVID-19, I think we've asked you this before, it continues to be a persistent question. Can a person be reinfected? What's the latest on that?
Yeah, it's a great question. It's a very common question, and it's an extremely important question. We don't have a ton of data yet for this virus. The prevailing theory is that if someone truly has this infection, then they recover from this infection. It's extremely unlikely that during the course of this pandemic, they will get this infection again. That might not be entirely correct, but it's the prevailing theory. So it's unlikely that they'll get this again. If we just take it a little bit farther, and this is purely theoretical, many people are speculating that, if this virus persists, it just after the pandemic at very low levels, maybe we see it in the winter, like the flu, maybe it changes enough from year to year that people can get reinfected with this. But for the purpose of this pandemic, the prevailing theory is once you get it, you're unlikely to get it again.
We're hearing more and more people warning of what a worst case scenario could look like in our healthcare system. What are your concerns as far as supplies?
Yeah, I mean, clearly there is an issue. If we are burning through our personal protective equipment at the current rate, in many jurisdictions, the stockpiles will run out. And of course, we know that the procurement officers at hospitals and also at the provincial and federal levels are working to acquire as much of this equipment and other equipment as fast as possible. I think a positive ray of hope here is yesterday, our Minister of Health, Patty Hajdu, made an announcement that Justin Trudeau is going to enlist the help of Canadian industry. And I think this is an extremely important move here. We have a ton of business and a massive industrial complex in Canada. And if we focus that industrial complex on producing or acquiring some of the tools that we need to help fight this epidemic here in Canada, I think we'll be far more successful. And kudos to people who are really making local solutions to local problems. But if we can scale this and really resolve this issue on a national level, I think that'll be far more sustainable.
Labatt's making hand sanitizer, some of the automakers working and retooling to do masks and shields and things of that nature. You're right. That's part of our coverage of this story today, too. All right, let's jump into more viewer questions, okay? Mentioning hand sanitizer and hand hygiene. Question from Ken Miller wondering, are we killing the virus or are we simply washing it off our hands?
No, we're killing it. Soap will basically disrupt the membrane around the virus. Hand sanitizer will annihilate that little membrane around the virus. So it's dead. Yeah, it is totally dead. It's not going to be a viable option. It's not just washing away. It's done.
Fantastic. Thank you, Ken, for the question. Janet Brunel would like to know, Dr. Bogosh, this is a good one. I've not heard people ask about food, but are we better to cook our fresh produce? Are we still okay to eat it raw as long as we wash it before eating, if we wash it thoroughly, or is that even a consideration?
Yeah, it's a great question. We know the virus can certainly live on surfaces. And of course, if we think about, how we get food, you go to the grocery store, you take some broccoli or some apples and oranges. Other people might have touched it. That's a really good point. But I think we know that the virus won't live on organic surfaces for that long. it's going to be in their fridge as well. So I think just washing it with water is going to be completely fine in those situations. Yeah.
Okay, I'm going to tell you something. Maybe I have overreacted, but I went grocery shopping this weekend, as so many did. And I wore a pair of latex gloves into the grocery store as I was collecting my things. Now, I'm not the only one to do that, I know, but I'll just use myself as an example. And then I was listening to your colleague, Dr. Samir Gupta, saying that's an overreaction, except I pitched mine right out, so I didn't reuse it, and I didn't touch my face. But do we need to wear gloves when we handle things like food or purchase things or pick up things?
No, I think in general, we don't really need to do that. But having said that, I completely appreciate that everyone has their own risk perceptions, their own risk thresholds. We still have to get through our days, and I completely appreciate that these are challenging times. And, if that just helps someone get them through their day and facilitate getting groceries and facilitate caring for themselves and their families, fine. But in general, it's really not necessary.
All right. I think he was saying that it might even encourage you. You might feel safe, so you touch your face, and you might be more inclined to transmit. I just threw mine away immediately, so I don't think it was a factor there, but maybe not necessary at all. One more question this time round. Let me just get the name here, make sure I give credit where credit is due, because it's a great question. Julie Jameson, do you think, Dr. Bogosh, summer camps should go forward this year? Many kids are gearing up for the season ahead, and if things have settled down by then, could this not lead to a secondary outbreak?
Yeah, Julie, that is a fantastic question. And, sadly, we do not have a crystal ball. Just from my own personal experience, my kids are hopefully going to go to summer camp as well. But we've been receiving messages from the camps. The ones that we've been looking at have been very transparent, saying, we're not sure if this is going to be on. We're not sure if this is going to be off. Safety of the kids and public safety is number one. If this is off, everyone will get a full refund. And I thought that was an extremely responsible message. And I think we still don't have an answer to that. Sadly, I know we want to prepare. We just don't have an answer for that just yet. We're going to be in this position for a minimum of 2 months, but it might even be longer. And we're not entirely sure when life will slowly start to return to normal. So I'm not entirely sure what the answer is for that one yet.
Just be clear on that. We're going to be in this position for 2 months? You mean in this position of extreme social distancing, physical distancing measures, self-isolation? This is not a short-term couple of week things. We're talking about months. People should understand that.
Yeah, absolutely. I don't think we're going to lift the restrictions that we currently have now in Canada for a minimum of 2 months. And, we'll see what the senior health officials of Canada suggest. But, I mean, if we look at other places around the world, we're in for a marathon, not a sprint here. And I think it's a minimum of 2 months before we start to see, or before we start to even think about changing some of our current practices.
I think that's a really important thing to start to come to terms with in our minds as we mentally prepare for the long haul. Yeah. We had Megan Fitzpatrick at a blood donation clinic this morning because they're concerned about donations dropping off. Edmund Crayston would like to know, is it safe to donate blood? He's scheduled to give on April the 6th.
Yeah, I mean, it certainly is. And wow, what a great time to donate blood, and what a wonderful thing to do, especially when it's needed the most. We know that our hospitals are going to be busier than normal over the coming months. Certainly, there is going to be a need for blood. And of course, everything if people can donate, they certainly should donate. I know the blood donation centers are doing everything they can to make sure this can be done safely with hand sanitizer, with washing down surfaces. So this can certainly be done safely, and people are encouraged to continue to donate blood.
We have a question from Calvin Pokiak, and I think it's the first question we've ever had directly from Tuktoyaktuk, Dr. Bogosh. So this is fantastic. It's a question specific to there, but not exclusively to there. There is a shortage of housing, as you know, all across those territories, and there are restrictions in place of 10 or fewer people in a home. Some families, as Calvin writes, have as many as 15 people staying in 3-bedroom units. So what is your suggestion for how people can socially separate within those fixed confines?
Yeah, obviously that's a huge challenge. I have had conversations with certain people in leadership positions in northern communities to sort of discuss different strategies of how to control the virus in those settings. And obviously it's a challenge. I think the key thing here is we've got to make the best with what we've got. And, if there's any opportunity to have fewer people under one roof, that's ideal. And certainly if there are a significant number of people under one roof, it's really important that everyone adhere to these physical distancing measures, because no one wants to go out, get this infection, and then bring it back into the home. So it's even more important for all people under that one roof to do their best to practice good hand hygiene and really ensure that they keep a good physical distance from other people when they leave that house, so that they don't get that infection and bring it home.
Calvin, thank you for your question, and we wish you the very best in the north of our country. A question from Brian Ritchie, Dr. Bogosh. If I have someone in isolation, do we need to keep pets from moving in and out of the isolation space? Can there be concerns about the fur? We had that similar question from Helen Pace as well. Actually, we're getting lots of questions about pets and transmissibility.
Yeah, I think it's a very reasonable thing to do. We certainly are telling people not to shake hands and not to give high fives. I remember when that came down in the NBA, they were telling players before it was canceled, don't high five each other. And certainly we should be very mindful that this infection can stick to surfaces, and pets are probably no different. So if someone is infected or is on an isolation, it has to be in isolation for whatever reason, yeah, the pet should certainly avoid that individual. Now, of course, we know dogs and cats need love, and it just means that the other people in the house should be providing that pet with extra cuddles and pets.
That's your veterinary question, not just your human medical question for us, Dr. Bogosh, today as well. Our final question, because we've been getting many from our viewers about the food that we're eating. Thankfully, the grocery supply chain seems to be intact and people are getting food. I noticed there was a lot in the grocery stores today or this past weekend. But Elizabeth Levine would like to know about what you can handle safely. So is it safe to buy bread and bagels from small bakeries, things like rye, which, for example, is sliced fresh, although I do notice that a lot of the grocery stores are no longer doing that kind of slicing, but kinds which are sliced, prepackaged bread at the supermarket. Does she need to wash the plastic bag, for example, before she opens it or freezes the bread?
No, I don't think so. I mean, I think it's important that, obviously that these supply chains are open. And of course, we know that there's many businesses, small businesses too, that are suffering. So if you can support a local small business, by all means, that's just fantastic. And in terms of keeping safe while you're doing so, if you're freezing bread, that's just fine. The virus is definitely not going to survive being in your freezer. But also, if you are touching that plastic bag that the bread is in, okay, as if someone else might have touched that, just be mindful to wash your hands after touching that plastic bag.
Could wipe it off, I suppose, before you pop it in?
Yeah, of course.
Sure.
Yeah, absolutely. 100%.
Listen, join me, Dr. Bogosh, in thanking our viewers for those amazing questions. And I would thank you for the time you've given us again today. And given the stack of questions, unfortunately not able to get to all of them as much as I tried, would you come back and talk to us again?
Oh, yeah. Happy to chat anytime.
Thank you so much.